Hey, good afternoon, everyone, and welcome. My name is Brandy Hake. I'm a national Medicare marketer with Premier Senior Marketing. Thank you so much for taking time out of your busy schedule to learn more about one of the leading carriers in the industry, Mutual of Omaha. The webinar will begin at the top of the hour. Before we start, I wanted to mention all the wonderful things Premier is offering. As a leading FMO, we have 4 experienced health teams to provide support, sales ideas, and training. We also offer an agent portal to put the ease in submitting and tracking business. Next is our Medicare quoting tool, a $1,000 value free when you contract with us. Last but not least is our co-op lead program, such an important incentive to helping agents offset their marketing costs. Our top priority is to help you grow your business. Please contact us anything that you need at 1-800-365-8208 or visit our website at premiercoinc.com. I now would like to introduce our presenter, Christy Myers, who has been a fantastic partner with Premier. Christy, you have the floor.
Thank you, everyone at Premier, and welcome, everybody. Thank you for joining us this afternoon. Premier has came to me today and wanted me to present high level some of the value adds and things Mutual of Omaha will bring to the table for you to help you grow your Medicare Supplement sales with us. Today I am joining you. I'm actually here in our home office today, located in Omaha, Nebraska. We're actually just a couple hours away from Premier Senior Marketing, and they have been tremendous partners with us for many, many, many years and are definitely a leading FMO within the Medicare space itself. So welcome to all of you. As previously mentioned, I'm going to go through these slides pretty quickly. Questions that you would have at the end, please direct them back to one of the health teams at Premier Senior Marketing. If there is a little bit of time permitting at the very end, any question that you would have, please enter that into the chat and we'll get to as many as we can potentially at the end here as I wrap things up today. So let's go ahead and jump right on in. Why Mutual of Omaha is such a leading market leader in the Medicare supplement space. First of all, just a little bit about Mutual of Omaha in total. We've been around now for more than 100 years. We were founded in 1909, actually in Omaha, Nebraska. The picture that you're seeing here today on screen is our home office, located right in Midtown in Omaha. I'm located in the building on the left-hand side, but we do have space over there on the right, which is home to Mutual of Omaha Bank. We're a mutual company, so that simply means we are owned by our policy holders. We're not managed by shareholders. That has served us well for these over 100 years. And in addition to Medicare Supplement, well, that's a key product here at Mutual of Omaha, we do have many other products both in the individual lines as well as in the employer insurance space to help meet the needs of your clients and potential business owners that you work with. We have very solid financial ratings. This is going to simply mean at time of claim, when somebody needs us to be there most, we are going to be there for them. We have been consistently ranked as A+ Superior with AM Best. It's probably not something that comes up a lot within the Medicare space, but if it did, you would know that you are definitely working with someone who is going to be very financially stable, not only in the past but to the future looking forward. Regarding Medicare Supplement specifically, we are definitely an experienced provider. We have been providing Medicare Supplement now in the market for over 50 years. Last year we celebrated our 50 years in the market space, which we began selling Medicare Supplement plans the very first year that you could begin doing so, which was in 1966. So we have been here through it all and continue to want to be in this space for many years to come. Currently, we are, in total, the second largest Medicare Supplement provider in the United States, and that number, our market share, continues to grow. We are coming off of another record-setting year regarding Medicare Supplement premium coming in the door. Last year, we exceeded over $2.5 billion in earned Medicare Supplement premium. A few other quick bullets here on screen. We do offer some of the top commissions within the industry for those street-level commissions that we offer. Another key advantage, if you elect to have commissions paid through advancing, we do not charge interest on advancing within our Medicare Supplement line. And a way to save your clients money, we do not charge a policy fee or application fee when you do business with us. Our MedSupp product line is offered in every single state except for that of Massachusetts. One great thing which is going to allow you to lock in a premium rate for a client is that we rate guarantee our rates at time of application for 12 months following the policy effective date. So going into more detail on that one, we actually allow, if you're taking an application for someone who is in their open enrollment period, we allow for you to take an app for someone who's turning 65 6 months prior to their 65th birthday and their Medicare Part B eligibility date. So 6 months prior to, you can have them sign an app. Well, they would be locking in their premium rate at that time, and then as soon as their policy goes into effect, we rate guarantee for 12 months following that policy effective date. So that's a long period of time in which they would not have to incur a rate adjustment because of that lock-in period for 12 months. Our Medicare Supplement policy is also a great cross-sell opportunity with some other individual products that we offer within this senior health space, which would include final expense, children's whole life, and then our cancer, heart attack, and stroke policies. Anyone on the Premier Health team can help with those products or get you in touch with the correct individuals within Premier. Taking a look at our state footprint right now for Medicare Supplement, we underwrite our Medicare Supplement product line under 4 different underwriting company names. They're listed there on screen. I'm not going to list them all. The key thing for you to know is that at any given time in a particular state, we only write new business as one of these underwriting companies. And as I switch to the map, it's going to make some more sense here. So currently I'm in Nebraska, and Nebraska is color-coded as pink. That currently means right now new business sales are being sold as Omaha Insurance Company. However, we do have a block of business that had been previously sold under one of those other underwriting companies, such as Mutual of Omaha, United of Omaha, or United World. And I often get asked, well, why do you change underwriting companies? And there's a very good reason for that. The Medicare space is a very competitive space. There are new entrants joining this market every single day. Because we've been around since 1909 and we've been selling this product since 1966, if I did not come out with new competitive rates under a new underwriting company name in a given state, Mutual of Omaha would not be competitive. We would not be here on this call today, and I wouldn't have a product that you would want to sell because our prices would be non-competitive compared to other people that are playing within this space and selling Medicare Supplement today. A few other things to point out on this map, which everyone at Premier would have and can share out with each of you. Underneath the state name, you're going to see the letters. So if we take a look, let's say, at Texas, Texas is being sold new business as United World, and you see the letters A, F, an F with an asterisk, G, and N. That means in the state of Texas, we are selling plans A, F, high deductible F, G, and N. The other thing to make note of on the map is the number percentage below those letters, and I'll go into more detail what that is. But the percentage under there is indicating what is the household discount available in the state that I'm looking at. If there's a 7, that means it follows the 7% rules, and if there's no number there, that's going to mean that that state does not currently have a household discount available for consumers. So that's kind of our footprint in a nutshell. Like I said, the only state we're currently not selling in is going to be Massachusetts, which is color-coded up there in black right now. Moving on to our plans, Plan G by far continues to be our most popular plan sold. Currently, we sell over 60% of new business sales are going to be that Plan G. Plan G, all the only differences between Plan G and Plan F is the Part B deductible, which this year in 2017 is $183. Once your client pays that $183 and that is met, Plan G is going to work exactly like the Plan F does. So I encourage you, quote the Plan F, quote the Plan G, take the Part B deductible added into those Plan G premium amounts, and if there's a savings between those numbers and the Plan F premium, really ask your client if Plan G is going to be the best plan for you, especially knowing you can save them some additional dollars, and then maybe you can use those dollars to cross-sell them another product such as final expense. That household discount that I touched on earlier, we do have two different categories of discount percentages available, and it is going to vary by state. The majority of the states currently do have our 12% household discount, which in order to qualify for that 12% household discount, there are two ways in which an individual qualifies. The first one is that they are applying for coverage and they reside with their spouse of any age. That's something I've heard agents, they don't realize that the spouse does not have to be at least age 60 or older. So that being said, if I'm a 66-year-old and Brandy is taking my application today and I live with my husband who is 46 years old, the fact that we are married and we live together, I would qualify for that household discount of 12%. The other way in which I could qualify for the 12% household discount is maybe I'm 66 years old and I've lived with my sister who's 62 and we've lived together for the last 5 years. I don't have to be married to her, but the fact that I'm living with someone else over the age of 60, I would also qualify for that discount. With this definition to qualify, the majority of individuals are going to fall into a category to receive that 12% household discount. In Missouri, the household discount is also 12%, and in order to qualify there, you just simply have to live with your spouse or domestic partner. As I mentioned, the majority of the states currently do have the 12% household discount. They're all listed there. I'm not going to go through them all, but it is a good handful of the majority of states. Let's move on to what that 7% household discount then looks like. So we as a carrier, we have tried to get the 12% approved in all of the states. The ones that currently have 7, it was filed and the DOI did not approve. For the main reason that they feel both individuals and the household should have a policy for Medicare Supplement in order to get the discount, which is what that 7% household discount rule is. So in order to get this 7% household discount, both individuals in the household have to have a MedSupp policy, either with the current underwriting company or with one of our affiliates. If they fall into that category and they both have policies with us, then the rates would be deducted by 7% for the discount. There's only 10 states that have the 7% right now. Those are listed here on screen for you. And like I said, we've tried to get to 12, but for now the states are holding firm on it will remain as 7. And because it's MedSupp and there's always state specifics, we have a handful of states that don't have any discounting available whatsoever, either because we haven't filed the product in these states with a household discount attached, or the states simply do not allow for discounting on Medicare Supplement premiums. A little bit regarding rates beyond the household discount. In 2017, Mutual of Omaha is working to move all of their MedSupp product lines to be anniversary rating. Anniversary rating simply means, rather in a state, let's say that's attained age, rather than a client potentially having 2 rate adjustments in a given year with Mutual of Omaha, one being for a claims adjustment and one being for an increase in age, we're moving the block to be anniversary rated. So it's going to mean each year on their policy anniversary date, they would incur the rate adjustment for that year. So they will only have 1 rate adjustment now moving forward with us. We've been slowly adding this to states as we've been changing underwriting paper starting last year, but this year we're going to move over all new business sales to be anniversary rated. The older in-force blocks are going to move at a later date, most likely throughout the next couple of years to get everybody onto anniversary rating. It's something we've been hearing from our sales partners for a long time, and I'm very, very happy that we're moving forward with anniversary rating just across the board. We do have a few value-added programs. Right now we have 3 of them that come with the Medicare Supplement policy. All of your clients would hear of these value adds that are available to them within their policy output. The first one is a vision discount program offered through iMed. iMed's going to offer them a discounting on eye exams, frames, any vision care that they need. All they need to do is go to a participating provider and show their Medicare Supplement ID card with us in order to get the iMed Vision Discount Program. The other one that we added in is a hearing aid discount program offered through Amplifone. And I think the biggest thing I hear from this program from agents is that it does provide a 2-year supply of hearing aid batteries, which is a value of about $150. So both of these will be in their policy output. There are a few states that don't allow for value-added programs, and those are listed there. So people in those states are not going to be able to get the iMed or Amplifone discount programs. This next one, which is the Hospital Choice Savings Program with USA Senior Care, was launched last year. Very simply put, this is a program in which if policyholders need inpatient hospital care, and if they go to a participating hospital, which is completely voluntary, because they're going into a participating hospital, there's a premium savings regarding that Part A deductible that has to be met. Because there's been a premium savings because of that, we're sharing some of the premium savings back with the client, so that policyholder is going to get a $100 premium credit on their next paid to date for their Medicare Supplement plan. So each time they go into the hospital, they pick whatever hospital they want. It's still a MedSupp. As long as they take assignment, they can go to that healthcare provider. If that healthcare provider happens to be in network, they show their Mutual of Omaha MedSupp ID card at check-in. They continue to pay their Medicare Supplement premium as usual, and then on that next premium renewal date, they're going to receive a $100 premium credit. It's not available on plans A, high deductible F, M, and the select plans, however. So just one other value-added thing, there is a letter within the policy output for the client that describes how this program works as well. As a result of adding this program into our MedSupp portfolio, the ID cards did change. So it does show now the USA Senior Care Network logo on our MedSupp ID cards. To see if the hospital that they are going to is in network, they can either go online at usamco.com/MOOIC, or they can actually call USA Senior Care directly at the phone number listed. Few states, as mentioned, because it's MedSupp, that don't have them. Those are listed there. There are 2 states we're still waiting for DOI approval, and those are going to be Ohio and Washington. And you can watch Express, which is our agent communication, to see when those are added in. A little bit about our e-application tool. We have had our MedSupp e-application tool now since 2011, so a very, very long time in the market space. I continue to hear it's one of the easiest ones to use. At this point in time, over half of our business comes in using our MedSupp e-app, and there's good reason for it. It saves you and your client time. It definitely is going to ensure accuracy for both you and for them. It's very, very quick. The majority of apps coming in through the e-application tool actually auto-issue. That simply means behind the scenes it went through all the rules that we have in place, and because it passed and was in good order, it will issue. A lot of times the open enrollment cases can issue in less than a minute. That's going to mean at that point in time you're going to get an email notification telling you that application has been issued and is approved. And then if there are the option of sending out the temporary ID cards, you'll get a copy of those as well. Lots of times I hear it's actually issuing and you're still sitting there talking with the client, or they're on the other line waiting to hear back from you and that policy's issued. So extremely quick on open enrollment cases. If it does happen to be a case that needs to go through underwriting and it's going to be fully underwritten, right now over 50% of those apps are reviewed within 20 minutes of you submitting the application to underwriting. And that's going to be normal business hours, but very, very fast. Overall time service for all app types coming in on eApp is less than 2 days. So much quicker than paper is going to be. A few other key features regarding the MedSupp eApp. As I mentioned, the underwriting rules are going to be automatically applied. If anything, if you've been out there or have had to take fully underwritten apps in the past, I think one of the most complicated things, primarily because of the spellings of all these prescription drugs, the eApp is actually tied to an FDA database of all the prescription drugs recognized by the FDA, and because of that, it knows the common dosages. So the entry screen for entering in a prescription drugs on a fully underwritten app is very, very easy, and you just pick from drop-down menus to enter in their drugs, and it's legible and very simple to use. The visual cues are going to tell you where you're at and what missing information there is on screen. I think most importantly, one signature is going to cover all forms, not only for yourself, but for the applicant as well. For a while, I had producers question and see, they said they didn't want to use the eApp because they couldn't keep a paper copy of the completed application, where you most definitely can. You would complete the app all online. Once the client has actually signed the application, you can go back and print a hard copy of that PDF for yourself and keep it for your records. And then we do have multiple signature options available, which I'm going to review here next. So there are 3 ways in which the client can sign. I'll start with the one that's least common, which would be you would complete the application all electronically using the MedSupp eApp, and for whatever reason they would like for you to print off a hard copy, they want to review it, and then they're going to wet sign. You can most definitely do that, and it would just be known as a wet signature. The other 2 are going to be more electronic in nature. The first one being you as the agent complete the application, and when you're ready, the system will send an email to your client. The client gets an email notification from Mutual of Omaha indicating to them that they have a pending Medicare Supplement app to sign. They will go into their email, follow the prompts, and they are presented with a PDF copy of that application to review. If everything looks good to them, they simply have to hit 2 buttons. One that says they've reviewed the application, and the other being that they agree to the terms and conditions of the application. Once they've done that, they hit submit, and that application is now at Mutual of Omaha and ready for processing. The third signature option, which is becoming more and more popular, and it would work great in a situation if maybe the client's in your office and they don't want to log into their email right then and there to check for the app that's coming through that needs to be signed. We actually have an 800 number that the client can sign this application. The phone number is available 24/7. They don't have to speak with anybody. All they need to do is provide on the telephone the authorization number, which you would provide to them once you've submitted the app, as well as their date of birth. Once they confirm those 2 pieces of information, all they need to do is listen to the prompts on the IVR, and at the very end, the IVR is going to have them state their name, today's date, and that they agree to the application. If they all do all of those things, they have then voice signed their application, and it is at Mutual of Omaha now and ready for processing. That one is becoming the fastest growing signature method that we have out there because of its ease of use. So 3 different ways to sign, all of them very, very convenient for both you and your applicants that are signing up for coverage. Another bit of technology that we have available for use for all of you, I know Premier has quoting software for you, but if you're in an instance where you're maybe not in front of your computer or you don't want to log into their site, we actually have a mobile quoting tool available that you can download to your smartphone or tablet. It is available for both Apple and Android users. All you need to do is go to your respective app store. You're going to search for Mutual of Omaha, and then you're going to go ahead and pick quotes for sales professionals. Once you do that, not only can you get quotes on the go for Medicare Supplement, but a lot of our other products that are out there as well, including the final expense, our long-term care product, some other life products as well. So you would always be able to provide a quote, including with that household discount on the MedSupp, using this smartphone mobile quote app. Jumping in a little bit to marketing, I know Premier offers a lead co-op program to help get you reimbursed. Mutual of Omaha also has some marketing programs available for you. One of them, and probably the most common and frequent one that we see agents use, we have pre-approved mailers that we will print for you at no charge. They're already been filed and approved by all of the state insurance departments. We print your information and contact information on these cards at no charge. All you need to do is provide the address and add postage. They're all available to view on our website, Sales Professional Access, or you can reach out to one of the Premier Health teams and they can show you where to find those. But to show you what they look like, they're very professionally done. They're going to vary a little bit by state, but in this instance, you would be picking in the state or the zip codes that you want to market to. You can pick the ages that you want shown on the postcard. So maybe I want to show age 67, 70, and 72. I then pick the 2 plans that I want to show the premium rate for in the area that I'm mailing it to. And then that line 1, 2, 3, 4, and 5 is going to be your contact information. The other side has your name on it again as from the from field, and then where the consumer's name and address is, that's what you would have to get overprinted and then add postage. The key thing being that we will do these for you in 4 color at no charge. We also have MedSupp consumer brochures, so as you're ordering applications, if you want a nice leave behind piece for Medicare Supplement, this brochure is available in all of the states that we sell in. So it's just a good leave behind piece as you're taking applications, and they can be ordered by calling into our supply area. And once again, these are printed and shipped to you at no cost to you. A little bit about our reimbursement program for agents that we have available. We refer to it as the MedSupp Marketing Credits Program. And in order to earn credits, all you need to do is in any given month in which you have 5 or more issued apps, you're going to earn credits. And credits are really the same thing as cash. And the way those credits are earned is on paper apps, you earn 0.5 percentage point of the AMBP, and on e-applications, you earn 1% of the issued AMBP. And then those credits build up, and then you redeem them. A lot of agents redeem them because they've bought leads or they have paid postage. All you need to do is submit receipts here to Mutual of Omaha for the amount that you've paid out for those leads or postage, and then whatever your marketing credits balance is, we'll reimburse you up to that amount. Each year we have agents that are earning hundreds and hundreds of thousands of dollars with this program, so it's a great way to help supplement your business building activities. The next way I wanted to show you where we offer you a little bit more in the form of making additional dollars selling our Medicare Supplement product is our Mix of Business Enhanced Renewal Commission Bonus. And what this really boils down to is we want more of your fully underwritten business. And when you give us that fully underwritten business, we're going to actually pay out some additional compensation in the renewal years. So it might be easier if we look at an example here. In any given quarter, because these go by quarter, in which you have a fully underwritten amount between 40 to 49%. In the renewal years of 2 through 6 in the majority of states, you're going to get an additional 2 percentage points in compensation. If in a given quarter your underwritten percentage was 50% or more, your renewal bonus for commissions is going to be 3%, and at the end of the quarter, we're going to give you $30 cash per app. Now, common questions I often get, is the 2% or the 3% only on the fully underwritten apps? No, it's not. It is on all of the apps in which you wrote within that quarter are going to get that additional bump in renewal comp. The $30 cash per app is also for all the apps that you wrote in that quarter, as long as you were 50% or over. The other common question I get is how many apps do I have to write in the quarter in order to qualify to get one of these Mix of Business bonuses? And that number is going to be 1. If you wrote 1 app in the quarter and it was fully underwritten, that meant your percentage of underwritten business in the quarter is 100%. So that one app in the renewal years is going to get an additional 3% for years 2 through 6, and we're going to send you $30 at the end of the quarter for giving us that one fully underwritten app. Let's look at a quick example here. So this is going to assume you're at a street level compensation level for years 1 through 6. You're going to go ahead and you're going to issue 10 policies in Q1 of 2017. Each of those policies has an average AMBP of 1,500, and overall you have an 85% persistency for years 1 through 6. In that example, the standard commission for the 10 apps issued would pay out $13,703 over a 6-year time span. If that mix of business had been 25%, there's no mix of business bonus added. You would just simply receive the $13,703. However, if that mix of business in the quarter was 40% fully underwritten, you're going to get the additional 2 percentage points in the renewal years. So you're seeing how that reflects out for an additional payment above and beyond that $13,703 of $946 over 6 years. However, if you're at the 50% mark, you're going to hit that 3% renewal commission bonus, which over time, including the quarterly cash for apps of $300, you would get an additional $1,719 in compensation over the $13,703. So you can see how this is going to pay you additional dollars for that mix of business that we want in the door, which is that fully underwritten mix. A few numbers that you should definitely be aware of, not in addition to Premier's number. The first one is going to be our sales support line, which is here, as well as our underwriting line. The sales support team can answer any pre-sale question that you have or product questions that you could potentially need a little added clarification on. And the underwriting line, they are available to you after sale. So anytime in which you have an app that's sitting in queue and you need to talk to the underwriter working on that case, you can call into underwriting and they will be able to help you. And by being able to help you, I mean the underwriter specifically working on the case in question. So definitely jot those 2 numbers down in addition to the number for Premier. And then I want to close out with telling you about our fabulous agent incentive trips that we offer here at Mutual of Omaha. They are known as the Mutual Sales Leaders, and right now agents are earning credits to travel next year to Killarney, Ireland for 2018. Those travel dates are listed here on screen for you. To qualify, you're going to need $225,000 in Medicare Supplement production credits to join us next year in Ireland, which is very, very close to St. Patrick's Day, so it should be a great trip. And you can always check your status at mutualsalesleaders.com. All you need to do is go to that website, enter in your Mutual of Omaha production number, and it will tell you currently how many credits you have available towards that trip to Ireland. So with that, that was all that I had today. I'm going to turn it back over to the Premier staff, and if there was any questions, we can take a few of those now. Otherwise, if you had questions, they're going to be directed back to the help team at Premier that you work with.
Thank you, Christy. Great insight, very beneficial information about Mutual of Omaha. I think this concludes today's webinar, and yes, any further questions, feel free to contact Premier Senior Marketing. One of our health teams would be more than happy to assist. Our phone number is 1-800-365-8208. I appreciate you all for joining. Have a great afternoon.
Thank you, everyone.